My name is Tara Mitschke. I did my fieldwork at the Public Health Agency of Canada. I'm in the Bachelor of Health Studies program, and my special project was entitled The Effects of COVID-19 on Elders and Long-Term Care. Within the Public Health Agency of Canada, I was working in the Regional Emergency Coordination Centre, which is a unit that was pulled together at the time of COVID lockdowns, so just a little over a year ago. This unit is responsible for COVID response, planning, and looking at short and long-term goals and visions. The work that I was partaking in is dealing with information sharing, gathering intel, and creating a decision-making tool. Originally, my special project was going to be a literature review, but was changed to a policy paper. I chose this project because the health of elders has always been a topic of interest for me, especially after seeing how some family members had been cared for. I always wanted and expected that more could be done in these environments and that in some cases was not. I took it upon myself to learn and explore the options that are there to help and alleviate the negative health effects experienced by elders in these places. My personal expectations was to create a paper that highlighted the effects of COVID-19 and how some of the restrictions had added to the mental and physical strain on their residents, while providing some solutions and practices that could be implemented. My plan was to spend the first months doing research and create an outline with a draft following, while getting feedback from my supervisor as I went. The final product was to be completed by the beginning of April. Overall, this was a very rewarding project. I think that I accomplished what I wanted with the information I was given and the time frame that I set for myself. However, every plan has its kinks. The draft took way longer than expected. Other work priorities popped up near the end of the placement, so at times working on this paper got pushed aside. Looking back, there were specific times that I could have been more proactive writing this paper, and I was not. As a plan, the idea was good and the checkpoints I made for myself were reasonable. Overall, I just need to be more proactive and diligent with my time. This project relates to my learning objectives because I wanted to gain more experience in writing policy papers. This paper was given to the agency as a starting point to expand upon the knowledge that is already in place. I developed more knowledge about the different practices that are out there. The topic of elders and health is something that I've worked on before, so I had the background of knowledge to expand off of. Policy is one of the best ways to see change happen. Having this experience in my back pocket is wonderful. This project helped me gain more experience in researching and writing policy papers. The most valuable aspect was gaining real-life experiences. Having a chance for someone that works in policy to read over and make edits was also very helpful. Being in an environment that was working towards projects that would benefit the agency was very rewarding. The Public Health Agency of Canada allowed me to grow and experience so many aspects of how government and health work together, and for that I am very grateful.